The liver is the largest gland in the human body and performs more than 500 functions, including producing bile, eliminating toxic and harmful substances in the blood, and regulating the metabolism of carbohydrates, proteins, and fats. From fatty liver disease to viral hepatitis, from cirrhosis to hepatocellular carcinoma, the liver can be affected by more than 100 different diseases, which cause it to no longer function properly. It will thus begin to send us some signals, which are not always easy to interpret, and therefore tend to be underestimated or confused with other pathologies. But what are they? Let's go see them. Pain. The onset of liver pain is a very common symptom in people with liver disease and is usually felt in the upper right part of the abdomen, just below the rib cage. It is important to underline, however, that the liver tissues themselves, in reality, do not contain pain receptors, so the painful sensation felt may be due to involvement of the surrounding structures, or to inflammation, or to a lesion of the connective capsule which protects the liver. In most cases, liver pain is due to obstruction of the bile ducts, a system of ducts responsible for transporting bile, or hepatitis, and inflammation of the liver cells that can lead to increased tension on the capsule surrounding it, thus causing the onset of a dull ache. Hepatitis, on the other hand, can be caused by viral infections, by taking medications or drugs, by food poisoning, or by some autoimmune diseases. A rather mild but continuous liver pain is typical of hepatic steatosis, commonly known as fatty liver. This is an excessive accumulation of triglycerides inside the liver cells, which leads to a pathological enlargement of the liver, known as hepatomegaly. Dark urine and pale stools. Urine is nothing more than the final product of the excretion of the kidney, which originates from the blood filtration process, and through which the metabolic products dissolved in the blood flow are eliminated from the body. Under normal conditions, in a healthy person, the urine is clear, straw yellow in color, and does not emit a bad odor. However, in case of severe dehydration or a problem with the liver or pancreas, they can take on a color tending towards intense orange or dark brown. This is due to an excessive accumulation of bilirubin in the blood, where a part is inevitably filtered by the kidneys and eliminated through the urine, consequently giving it a dark color. At the same time, an insufficient quantity of bilirubin will reach the intestine, resulting in a reduction in the formation of stercobilin. It is a pigment that gives feces their characteristic brown color and derives from the metabolism of bilirubin by the microbial population that lives permanently in our intestine. The reduced production of stercobilin thus determines the formation of light and pale stools. Among the most common causes we find obstruction of the bile ducts, liver cirrhosis, hepatitis, and in some cases, the presence of a liver tumor. In the last video, which you can find by clicking above, we saw in detail what the initial signs and symptoms are. Jaundice. The liver, together with the spleen, participates in the disposal of red blood cells that have reached the end of their life cycle. From the degradation of the hemoglobin contained within them, bilirubin is formed, a yellow-orange waste metabolite. Through the blood flow, it reaches the liver, where it binds to bile, passes through the bile ducts, and is finally eliminated with urine and feces, to which it gives its characteristic color. However, if the liver is not functioning properly, it is unable to process bilirubin, as well as if the bile duct system is damaged, inflamed, or blocked. At this point, there is an increase in bilirubin levels in the tissues, causing the skin to take on a yellowish color, to the mucous membranes and sclera, the white part of the eye. This medical condition is known as jaundice and can be due to many different pathologies or the use of certain medications. Among the most common causes we find hepatitis, viral and alcoholic, liver cirrhosis, gallstones, and in some cases liver cancer. Itching. The onset of skin itching is one of the possible complications of diseases affecting the liver, and its intensity depends on the specific type of pathology affecting the organ. It can present itself in a generalized or localized way, in this case affecting some specific areas of the body, such as the palms of the hands and the soles of the feet. Itching is less common in cases of hepatic steatosis, also called fatty liver, or following liver damage caused by alcohol consumption, while it is found more frequently in patients suffering from hepatitis C and biliary cirrhosis. Although some clinical studies have been conducted, researchers have not yet identified the exact cause of itching associated with liver disease, but rather a combination of several factors. Among the most probable mechanisms, itching seems to be due to the accumulation in the blood and other tissues of some waste substances that are normally secreted by the bile, but which, due to liver dysfunction, remain in the body. Among these we find, for example, bile acids, substances produced in the liver and secreted into the duodenum after meals in order to facilitate the digestion and absorption of fats and fat-soluble vitamins. The accumulation of bile acids can therefore activate specific nerve receptors present on the skin nerve endings, causing the onset of an annoying itching sensation. Fatigue and weakness. Asthenia, from the Greek absence of strength, indicates a state of excessive tiredness, weakness, and lack of energy, which inevitably reflects on the daily activities of the affected person, thus limiting the ability to carry out normal tasks and negatively influencing their quality of life. Fatigue is one of the most frequently encountered symptoms in patients with liver disease, but also one of the most underestimated, as it is often overlooked both by those who suffer from it and by doctors themselves. According to the result of some studies, liver inflammation can directly affect the central nervous system through various mechanisms. One of these is that it can lead to changes in brain neurotransmission, altering not only the production of some neurotransmitters, such as dopamine and serotonin, but also interfering with normal communication pathways in the central nervous system. The result will be the onset of a chronic feeling of fatigue and tiredness, which does not tend to improve with rest. A liver that does not function properly can also negatively influence the body's general energy metabolism, as it has a reduced ability to use nutrients taken in with food and convert them into energy available to carry out normal daily activities. Liver dysfunction can lead to a reduction in protein synthesis, an alteration in carbohydrate and lipid metabolism, and an accumulation of waste substances, including bilirubin, ammonia, and the metabolites of some medications taken. All of this contributes significantly to worsening tiredness and fatigue in patients suffering from liver disease. In conclusion, we have seen how the liver is an organ of extraordinary importance for the correct functioning and balance of our body. However, if you notice one or more of the symptoms described in this video, it is advisable to contact your doctor or a specialist in order to receive an accurate and timely medical diagnosis, as well as treatment appropriate to your medical condition.